Bismillah ar-Rahman ar-Rahim. Dear colleagues, ladies and gentlemen, it is great honor and a pleasure to be with you in this annual Rhinology conference held for the 17th time by the Otorhinolaryngological Society and for the second time in association with Pan-Arab Rhinology Society. On behalf of both societies, I welcome you all. Needless to say that I thank the organizers, the pharmaceutical companies, the conference organizing office, and the most distinguished national and international speakers. Last but not least, special thanks to our magnificent audience. We need to discuss the most demanding medical problems, to enrich and upgrade our knowledge, and to reach some conclusions and turn back with recent messages correcting our practice. I leave the discussion of the items of the program to my friend and colleague, Dr. Rida Kamil, the best organizer indeed. But I need your answer to a big question. The big question is where we are. Knowledge is expanding. High techniques is influencing the matter. Cooperation with other specialties, particularly ophthalmologists and neurosurgeons, so we can do many very difficult cases, whether congenital, major trauma, severe uncontrollable epistaxis, and some oncological items. Also, rhinoplasty has got a very good share in our specialty. In spite of that, there are many blind areas. For example, sinonasal polyposis. You can't guarantee recurrence. You can't confess to your patient that I am treating you once and for all. Chronic sinusitis, even the recurrence of symptoms may appear after very successful sinonasal surgery. Even deviated septum, most of our patients are asking whether the trouble will turn back or not. Also, turbinectomy, and the most challenging, snoring and obstructive sleep apnea, which you cannot guarantee the outcome of your surgery if you did. Next. Some minor but rather challenging symptoms: postnasal discharge, anosmia, cough and hiccough, headache, are very challenging symptoms which you are not sure to help your patient, particularly anosmias, which make a good challenge. There is no real parameter to assess the real cause of anosmia, and you can't tell the most feasible prognosis you can ever give to your patient. Next. Personal cases unsolved. I just like to introduce one of the cases is choanal atresia with deviated nasal septum in a mouth breather and complete nasal obstruction in a 6-year-old child with multiple congenital defects and with mental deficiency. How can you manage such a case and you can follow such a patient? It is very, very difficult. Osteoma, next. Next. You see this major osteoma in a young lady in the early 20s. The only complaint is some epiphora and nothing more. Can you volunteer to do surgery to such a case with the most possible complications for a minor symptom like epiphora. I am puzzled with that. We have to start, and so I once more welcome you, and I hope you very good stay, and thank you very much. And I have the pleasure to introduce my friend and colleague, Dr. Rida Kamel. All of you, I think, know Rida Kamel from his very, very major activities in the field of ENT and rhinology in particular, and endoscopic sinus surgery particularly. And he's the best organizer you can imagine to make conferences for the 17th last year's and 17th conference. Dr. Rida.
Thank you, Professor Fuli. Thank you very much for everybody. This is the 17th Rhinology annual meeting. I would like to extend my deepest gratitude and thanks to those who attended today amongst the current circumstances in Egypt. We are here today to make it clear that we have to work hard, hand in hand, to support the democratic march and the change in Egypt. We have to work together for the change. We are changing. Egypt should be as it should be, powerful from all aspects, especially science. I would like to thank you again, with special thanks to Professor Luning and dear Professor Guyel for being here despite all these circumstances. Truly. أنا يمكن أتكلم كلمتين بس بالعربي. حقيقي يا رب يديمها نعمة إن إحنا ده المؤتمر ال17 وإيد في إيد. إحنا طبعا النهارده جايين بنحتفل دايما كل سنة بالرينولوجي، والحمد لله يا رب يديمها نعمة إن إحنا موجودين النهارده رغم الظروف الحالية. لكن إحنا لازم نكرر ونؤكد إن مش ممكن كلنا نتوقف عن العمل. لازم نشتغل ولازم نعمل ولازم إيد في إيد، ولازم كل واحد لو كل واحد في الحتة بتاعته بقى فعلا بيحب مصر بيزق عشان مصر فعلا، أكيد إن شاء الله وإحنا متوقعين مهما حصل بلدنا هتكون جميلة عشان نسيرها لأولادنا محترمة. فإن شاء الله إيد في إيد نكون فعلا إن شاء الله قادرين إن نحقق الأمل بتاعنا اللي إحنا قاعدين بنفكر فيه، وربنا يوفقنا إن شاء الله في نياتنا الجميلة اللي إحنا حاطينها قدامنا. ومش ممكن تحصل الكلام ده غير لما كل واحد يكون مقتنع بيه، ومش ممكن يحصل غير فعلا بتعاوننا كلنا مع بعض. ويمكن رينولوجي اكزامبل جميل للعمل في مصر والعمل في البلاد العربيه الجميله. كتر خيركم طبعا كل واحد موجود من البلاد العربيه، الفريق السوداني والفريق طبعا العماني وبقيه الفريق جاي ان شاء الله النهارده. ربنا يوفقنا ايد في ايد تبقى بلدنا جميله والمنطقه بتاعتنا تبقى سليمه، واملنا كبير قوي قوي ان شاء الله في المستقبل القريب نكون كما يجب أن يكون. مصر هي مصر والمنطقة العربية هي المنطقة العربية. لما كنا زمان نقول من الخليج للمحيط، إن شاء الله تكون إحنا 22 دولة عربية. ربنا يوفقنا إن شاء الله نكون فعلا دول كما يجب أن يكون، محترمين قلبا وقالبا إن شاء الله. يا رب يديمها نعمة وكل سنة وانتم طيبين. We can begin the first session, please.